Welcome to the next chapter of our thyroid journey, where we will be going over what happens when the thyroid's, or in this case, a spy's, best laid plans go awry. First up, we will cover hyperthyroidism, which occurs when there are abnormally elevated levels of thyroid hormones. This will be depicted in this left panel, where our spy is on the run in a comically large bow tie. Next, we will go over hypothyroidism, which occurs when there are abnormally low levels of thyroid hormones. This will be depicted in this right panel, where our spy now has an untied bow tie and is about to come face to face with his adversary, Dr. Hashimoto. But before we dive into each of these conditions in more depth, there is one more thing we need to cover first, and that is a goiter, which is a fancy name for an enlarged thyroid that, depending on the cause, can be seen in both hypo and hyperthyroidism. If you look at this central panel, you'll see our spy has been hit in the neck by a rather large rock to help you remember this. Goiters are caused by high levels of thyroid stimulating hormone, or TSH like substances, which exhibit a trophic, or growth effect, on the thyroid. This is why our picture has such a large bow in her hair. Now, let's take a closer look at hyperthyroidism, starting with what can cause it. First up is Graves' disease, an autoimmune disorder characterized by high levels of thyroid stimulating immunoglobulins. These stimulate the release of thyroid hormones by binding to the TSH receptor on thyroid follicular cells, resulting in hyperthyroidism. You can see this represented by this gravestone embedded with antibody arrows that were fired at our spy. Because these antibodies mimic TSH, they may also cause thyroid hypertrophy, aka a goiter. These high level of thyroid hormones will also exhibit negative feedback on the anterior pituitary, resulting in low levels of TSH, shown here by these RIP TSH initials. A less common cause is certain types of thyroid neoplasms, represented here by this headstone with a cancer crab carving on top. These produce excess thyroid hormones, which via negative feedback also result in low levels of TSH. Hyperthyroidism can also be caused by someone taking synthetic exogenous T3 or T4, hence these synthetic T4 explosives. This is called factitious hyperthyroidism and is also characterized by a low TSH. Lastly, hyperthyroidism can also be caused by a TSH secreting tumor, such as a pituitary adenoma, although this is much less common. Because of this, when it does occur, you can expect to see high levels of TSH and an associated goiter. Now that you know what can cause hyperthyroidism, let's take a look at how it can present. One of its most common presenting symptoms is weight loss, despite an increased intake of food, which is brought on by the increase in basal metabolic rate. This extra emaciated assistant is stress eating, a rather large sandwich to help remind you of this. Increased thyroid hormone levels will also result in excessive heat production, which will present as heat intolerance and sweating. Note these drops of sweat. Thyroid hormones also upregulate cardiac beta 1 receptors, which makes the heart more sensitive to sympathetic stimulation. Because of this, those with hyperthyroidism will often exhibit a rapid heart rate, which is shown here by this elevated heart watch. Excessive thyroid hormones may also affect the central nervous system, which will present as muscle weakness or a tremor, and why this guy's hands are trembling in fear. Rad sweater vest, though. I wish I could pull that off. Last but not least is exophthalmos, a fancy word for bulging or protruding eyes, which is specific to Graves' disease and not hyperthyroidism in general. This is because the same antibodies that stimulate the thyroid in Graves' disease can also bind to fibroblasts in the orbital connective tissues. This results in enlargement and fibrosis that then causes the eyes to protrude forward. This guy is peeking out from behind the gravestone with a set of protruding night vision goggles to help remind you of this. Once diagnosed, hyperthyroidism can be treated with propylthiouracil, a medication that inhibits the synthesis of thyroid hormones. Surgery to remove part or all of the thyroid, or radioactive ablation to destroy part of the thyroid. Now, onto hypothyroidism. One of the most common causes is autoimmune or Hashimoto's thyroiditis. This is an autoimmune disorder with antibodies that destroy the thyroid or block thyroid hormone synthesis, resulting in low levels of thyroid hormones and an elevated TSH, and possibly a goiter. If you take a look at the right panel of our sketch, you can see this represented by the villainous Dr. Hashimoto, who just so happens to have an antibody-shaped prosthetic hand. Another less common cause of hypothyroidism is iodine deficiency. This is because iodine can only be acquired through diet and is integral to thyroid hormone synthesis, hence this briefcase of empty iodine vials. Since the problem lies at the level of the thyroid, this will present as hypothyroidism with a high TSH and may be accompanied by a goiter. Less commonly, hypothyroidism can also be caused by hypothalamic or pituitary failure, or as a side effect of a previous thyroidectomy. So, how can you expect hypothyroidism to present? Well, kinda the opposite of hyperthyroidism. For example, instead of weight loss, you can expect to see weight gain with no change in food intake due to a decrease in the basal metabolic rate. You can see this depicted by this unfortunate hostage who is wearing an excessively puffy jacket and has tape over her mouth. Then again, how many situations is there a fortunate hostage? I bet there's one out there. Like, oh no, I'm trapped in a ice cream factory. Low thyroid hormone levels will also result in decreased heat production, which will present as cold intolerance, hence this big bucket of spilled ice. You can also expect to see a decreased heart rate, see her low-hanging heart watch, as well as signs of lethargy and mental slowness, note her baggy, tired eyes. Hypothyroidism can also present with myxedema, a type of non-pitting edema, which is why this bartender is holding a drink mixer. This edema is caused by the accumulation of glycosaminoglycans in the interstitial fluid, which increases capillary filtration. This can also present as periorbital edema, hence the bartender's puffy face. Those with hypothyroidism may also report some hair loss. The last thing you need to know about is congenital hypothyroidism, which occurs when there is a deficiency of thyroid hormones in the perinatal period. When left untreated, this will result in irreversible intellectual disability and impaired growth, which is why neonatal testing for hypothyroidism is mandatory. You can see this depicted here by this baby girl with an untied bow tie. She has just dropped her quantum physics textbook as she prepares to foil Dr. Hashimoto's plot. To help you remember this, unlike hyperthyroidism, which may be managed in various ways, hypothyroidism is treated with thyroid hormone replacement therapy. And that's it for the thyroid. While we let Dr. Hashimoto gloat and needlessly explain his plan, giving the spy a chance to escape, monologues really, let's take a quick look back at what we've covered. Hyperthyroidism occurs when there are abnormally elevated levels of thyroid hormones, while hypothyroidism occurs when there are abnormally low levels of thyroid hormones. A goiter is an enlarged thyroid caused by high levels of TSH or a TSH-like substance. One possible cause of hyperthyroidism is Graves' disease, an autoimmune disorder with high levels of thyroid-stimulating immunoglobulins and, due to negative feedback, a low TSH. Certain types of thyroid neoplasm may also produce excess thyroid hormones, resulting in hyperthyroidism with a low TSH. Taking exogenous thyroid hormones inappropriately can also result in factitious hyperthyroidism, which is also characterized by a low TSH. Less commonly, hyperthyroidism can also be caused by a TSH-secreting tumor, such as a pituitary adenoma, resulting in hyperthyroidism with a high TSH. Common presenting symptoms of hyperthyroidism include weight loss despite an increase in food intake, heat intolerance due to excessive heat production, a rapid heart rate, and tremors or muscle weakness. In cases of Graves' disease, exophthalmos, or protruding eyes, may also be seen. Treatments include propylthiouracil to inhibit thyroid hormone synthesis and surgery or radioactive ablation to destroy part or all of the thyroid. One of the more common causes of hypothyroidism is autoimmune or Hashimoto's thyroiditis. This is an autoimmune disorder with antibodies that destroy the thyroid or block thyroid hormone synthesis, resulting in hypothyroidism with an elevated TSH. Hypothyroidism can also be caused by iodine deficiency, as iodine is integral to thyroid hormone synthesis and can only be acquired through diet. Less commonly, hypothyroidism can be caused by hypothalamic or pituitary failure, or as a side effect of a previous thyroidectomy. Common presenting symptoms include weight gain with no increase in food intake, cold intolerance due to decreased heat production, a decreased heart rate, lethargy, and mental slowness. Hypothyroidism may also present with myxedema, a non pitting edema which typically appears as an unusually puffy face. Lastly, when there is a deficiency of thyroid hormones in the perinatal period, this is called congenital hypothyroidism. If left untreated, this results in irreversible intellectual disability and impaired growth. Treatment for hypothyroidism is thyroid replacement therapy. And that's everything you need to know about the diseases of the thyroid. At least for now. And with that, it looks like Dr. Hashimoto is just about wrapping up, and things are about to get interesting. Whoops, never mind. He slipped on the ice. I think I like the old ones better.